Hey, it's Denise again. I have been spending the last couple weeks getting testing and clearances done. I had a little bit of a blip there. Um, about a week and a half. About a week and a half ago, I went to the appointment that was supposed to be my pulmonary clearance. But the night before, I had started having really severe in the middle of my back pain. By the morning, it was like straight through my back to my like epigastric area, and by the time I was in the doctor's office, there I am saying, "Hi, give me clearance for surgery," and I'm puking into his garbage can. So instead of clearance, I got sent to the hospital where I stayed from Wednesday to Friday. And then I didn't have a way to get home because I was in the hospital down by where not my surgeon, but, well, actually my surgeon's down there too. Not quite as far down, but in the same county. I was down seeing my pulmonologist, which is who I was getting clearance from. I just thought I was going down and coming back the same day. But I spent the next, from got out of the hospital Friday afternoon and stayed at my mom's until Tuesday because A, I didn't have a ride all the way back up here, and B, Tuesday I had to be back down there at 10 o'clock to be at the surgeon's group office. I thought I was just doing my monthly meeting with the psychologist, and no, she's a psychiatrist, and then my second mandatory support group. So that would meet my support group meeting requirements. They also were great while I was there. Not only did I see Dr. Allison, and that's her last name, because at first I was like, are they being casual and calling her by her first name? But no, she has a first name too that I don't remember. Allison is her last name. I saw Dr. Allison just real quick, and she was like, all right, other than being a little bummed by the delay of being in the hospital, you seem to be fine. You're on track as far as, being in the right mindset. And then they still managed to squeeze me in with a quick visit with the dietitian, so that counted as my visit for this month, so I didn't have to come back again. And they got me over to what they call a patient navigator, which is basically the person who does your insurance and lets you know how things are going with that. So I got to see 3 people, plus get my support group visit done at one appointment, which was really awesome. I props to Tri-State Bariatric because they understand I come from a long distance for these appointments, and they just group them together like that without me even asking them to this time. Okay, so after that, came home for a few days. On Tuesday, 3 days ago, I went and saw the cardiologist, and he told me that was it Tuesday? No, it was Thursday. I saw the cardiologist, and he saw me. Told me that I was clear. Oh, can you tell I'm trying to do this in a hurry? I'm making a ton of mistakes. So okay, 8 o'clock in the morning at the cardiologist. He goes over that the stress test was good, the echocardiogram was good. He's got no problem giving me clearance. Then we had a long drive down back to the pulmonologist because obviously he couldn't clear me based on the last visit when he had to send me to the hospital. So I got there. He did a couple more like spirometry type testing if you have asthma or any kind of breathing problem. You're familiar with those, just to show that I was at sort of peak shape as far as my lungs are doing fine. No signs of asthma or anything at the moment. So he said no problem. He was giving me clearance as well. And that was Friday. Today is Saturday. And I know the only thing I'm waiting on now is for Tri-State's people to sort through the paperwork, because they said the next step will be I'll get an appointment to come in and meet with Dr. Zepeda again. That's my surgeon. And that they said 9 times out of 10 at that appointment, that's when they set your date for your surgery. And I asked how far out in advance is he usually booked, like just to give myself an idea. And she said it's usually only 2 or 3 weeks. So I'm just sitting here like, a kid waiting for Christmas. I'm like waiting to get this call that I have an appointment to see him, and then hoping that he gives me a surgical date really soon. As I've mentioned before, I was only 12 pounds above the lowest you can be for my insurance to cover the surgery. So I'm a little concerned because I know I lost a little weight while I was sick. Turned out while I was in the hospital, at first I thought I had pancreatitis, but it turned out I had really high liver enzymes, which they think is from the Lipitor that the cardiologist had started me on. It's a drug for cholesterol. A lot of people take it and have no problems. I, unfortunately, was not one of those people. They actually had to stop a couple of my medications that could potentially cause problems with liver or the stomach because I had really high liver enzymes and I had gastritis, which is, for those who've never had it or don't know, it means just inflammation on the lining of the stomach. And they said possibly even the beginning of a little bit of an ulcer down at the duodenal area where your stomach meets the beginning of your intestines. So they gave me a month's supply worth of 2 different medications, Protonics, which is just one of those that cuts down stomach acid that you take once a day. It cuts down the production of, I should say, stomach acid. And Carafate, which I'm taking 4 times a day, which essentially just kind of coats your stomach and helps the irritated area to heal. So I've got another couple weeks of taking that anyway, and my stomach is not having the pains that it was having even up to just a couple days ago. So I'm feeling really positive because I don't want that to hold things up either. The only potential problem would be if when they are going to obviously recheck my liver enzymes to make sure they're normal before surgery. So I'm just hoping they're going down like they should, so that when they recheck them, they're probably going to want to do it in about 2 weeks. As long as they're back to normal or, approaching back to normal, then there should be no holdup on the surgery. I was pretty excited. My pulmonologist told me that with, the testing he did and the exam and my, overall, he's also my primary, so he knows any medical issues I have. He said that I'm, from a pulmonary and primary perspective, I'm low risk for the surgery, which was nice to hear. And at this point, I'm just waiting. I'm like, here I am sitting here like in my nightshirt and messy head. I just had a couple moments to myself here where no one else is either home or my teenage son is asleep, as they will be on Saturdays. So I just want to make this video quick. I weighed myself on my scale in my bathroom and I was 227. I had been 231 before I went to the hospital. So I've lost some weight and I'm just a little concerned because, as I was starting to say earlier, and then I think I totally derailed my train of thought, I can't lose too much weight before the surgery. And I think my doctor visit in the office with Dr. Cepeda is the last official weight they take to submit to the insurance company. So at this point, I'm like, oh, don't let me have lost too much weight. I'm probably going to go in there with no, I don't need to take my shoes or coat or pocketbook off. You can weigh me like this. Usually you're like sitting there practically stripping before they weigh you. But I'm also going to find out. I'm going to call and make sure how much, what the lowest weight is I can be, and make sure that I haven't gotten lower than that. This will feel so backwards if I have to try to put on weight before I go back. Once you finally make that decision to get healthy, which for me, I'm 50, as I've mentioned before, it took me a long time to commit to the idea. I never even really considered it before this year that I was someone who would need surgery to keep the weight off. And I've mentioned too that my physical activity went down to nothing, essentially, after my spinal cord injury. And that was in 2014. Well, the symptoms of it started even earlier and I was getting less and less active. But the official diagnosis and surgery, they couldn't fix what was wrong as far as the damage, but the surgery was there, like computer wants to go dark. The surgery was to prevent further damage. That was in 2014, and here we are in 2019, and I've gained so much weight. Not that I was skinny before, but I was 50, 60 pounds lighter. And if, you know, if you're watching this, I'm guessing you're probably someone who has had a weight struggle. And you know that going from a weight that, okay, I'm not skinny, but I'm comfortable in my own skin, which I was most of my adult life, to 60 pounds heavier than that, and now in a body that your muscles are not going to ever be as strong as they were before. There are going to be days that they just hurt or feel weak for, apparently no reason. The reason, of course, is in the spinal cord damage, but, it's not because I did anything different necessarily. There are days I can wake up with my legs, the muscles in my legs burning, like as if you just did a workout. There are days I wake up like that. So you can imagine what it's like walking on those legs, weighing 60 pounds more than I should. Ideal body weight, if you go by those insurance company things, I should weigh more like 100 pounds less. Although, honestly, I think I was in middle school last time I weighed, below 125 pounds or whatever. So, getting excited, just like I said, just two little things that could be a problem would be if my liver enzymes haven't gotten back to normal yet, or if I've lost too much weight. So here, cheers to my protein shake with, I threw in hemp kernels, which add healthy fats, and I throw in a chopped up frozen banana, because the protein shake itself really doesn't have a lot of calories, although I am so in the habit of having a shake for breakfast. I'm just upping the calories at this point so that I don't lose any more weight. And I guess that's everything. I just wanted to keep this short. I don't even think I did that. I probably went longer than I meant to. But again, if this helps anybody or gives them any idea of how things go, then I'm glad I did it. And everybody take good care of yourself.